This community update is brought to you by Multicultural. Cancer is the leading cause of job-related deaths for Canadian firefighters. In response, the Canadian government has introduced the National Framework on Cancers Linked to Firefighting with a $12.29 million investment over 5 years. Scott Wilkinson, Deputy Chief of Fire Rescue Operations and Training with Winnipeg Fire Paramedic Service, sees this as a positive step.
I believe most of the funding is being dedicated towards looking at some research and trying to study more and learn more about prevention, which I think is vitally important. We do have presumptive legislation for cancers here in Manitoba and also many other jurisdictions across North America. The problem with presumptive legislation is it's a great coverage, but you already have to have cancer to get it. So what we're really will focus on is prevention and trying to find that research that allows us to limit the amount of exposures so that people don't get those cancers.
Firefighters are frequently exposed to toxic chemicals, increasing the risk of cancers such as mesothelioma and bladder cancer. Firefighters face a 9% higher risk of being diagnosed with cancer and a 14% higher risk of dying from it compared to the general population. Wilkinson says WFPS has implemented many cancer prevention measures, including advanced protective equipment and strict gear washing protocols to reduce carcinogen exposure.
We used to wear our bunker, our turnout gear into fires. It wasn't washed immediately. And not only that, we actually kept some of that dirty equipment right next to us when we're in dorm rooms at night, thinking that it was helping for our response, but we're actually exposing ourselves to those carcinogens. So we've come a long way in that understanding. The concept of the salty firefighter or the dirty gear, meaning you're more experienced, I think most people have gotten past that now, and clean gear is the sign that we're looking for.
Part of the new funding will go towards establishing a National Firefighter Cancer Registry led by Statistics Canada to better understand cancer's impact on firefighters. Wilkinson believes this registry will bring much-needed awareness to occupational cancers and help prevent them in the future. Wilkinson also speaks on the importance of addressing mental health for first responders.
It's still an ongoing conversation. Here with the Winnipeg Fire Paramedic Service, we've had a great level of peer support from our internal teams over many decades. Recently, our own behavioral health unit, where we have direct access to trauma-informed clinicians, and that's really making a big difference in trying to treat and support our staff. And these days, it's getting harder and harder because not only is it the traumatic situations that they've experienced and some of those issues over time, but now they're increasingly facing threats of violence and other issues on the street.
Beyond physical and mental health improvements, Wilkinson adds societal issues like homelessness, mental health access, and addiction services need to be addressed to reduce the number of emergency calls firefighters respond to.
Right off the bat, I think some of it's societal, that we need to really work together to resolve some of the issues that we have in society that are impacting everyone, but really impacting first responders such as ours.
With continued support and collaborative efforts, Wilkinson believes the well-being of firefighters and the safety of the entire community will improve. You're listening to U Radio, where diverse voices connect. Stay tuned for more stories and insights that matter. With U Multicultural and the Local Journalism Initiative, I'm Ryan Funk.